Measles is a disease of public health importance that usually affects children younger than the age of 5 years. According to UNICEF and WHO, measles cases increased by 79% in 2 months of 2022, and this could give room for the spread of other related diseases. The virus, which can weaken the immune system, can be identified with these symptoms.
Measles is a viral illness, and it's highly transmissible from one child to the other. Many times when the child is presenting or the mom knows that the child was sick, the child will usually have developed the skin rashes. But prior to this, oftentimes the children would have had very high fever. They will have what we call conjunctivitis, red eyes, cough, things affecting the upper respiratory tract. Some of them will have diarrhea, abdominal pain, and all this will precede the incidence of or the onset of the rashes. By the time the child is having the rashes blown out, at that time the child is almost recovering. Unfortunately, that's often the times where the mothers will know that the child was ill.
Nigeria currently has the highest global burden of measles outbreak. Recently, the Lagos State government flagged off the 2022 integrated measles vaccination campaign in the state. The campaign is aimed at improving efficiency, effectiveness, especially at the primary health care level, so that parents, caregivers could access multiple services at the same time.
Yes, this integrated measles campaign is to further improve on what we call herd immunity of our children, so that there will be no transmission of measles in our society. Because of the past COVID pandemic, that is not past, we're still in it, we discovered that not all children got vaccinated at the right time, and now we've been having pockets of outbreaks all over the country and even our state, Lagos State. And that's why we are embarking on this particular campaign, which is a sort of like an outbreak response. We want to have as many, virtually all our children, we want to have them vaccinated against measles. So aside from the measles vaccines that the children will get, they will also be given oral polio vaccines, they will be given vitamin A, and for adults that are older than 18 years old, we will also be giving them COVID vaccines. Precisely the Johnson & Johnson type. That's why we call it integrated, because you're doing more than just measles vaccination. You're doing a couple of other vaccination with it.
Measles is a vaccine-preventable disease. Mothers with children under 5 years are encouraged to visit the nearest primary health care center and get their children immunized.